The ripple effects of recent US aid cuts have plunged South Africa's HIV response into its most precarious position in decades, threatening to reverse one of the public health's great success stories. Across the nation's research institutions and treatment centers, scientists and health workers are sounding alarms about a looming crisis that could erase years of painstaking progress against the epidemic HIV. In the laboratories of Wits University, where African researchers were on the cusp of groundbreaking HIV vaccine trials, work has ground to a devastating halt. Freezers filled with promising vaccines candidates sit idle as funding evaporates, setting back potential breakthroughs by years. We are watching 2 decades of research progress unravel in months, explains Professor Abdullah Eli of the Brilliant Consortium, his voice heavy with frustration. The implications extended far beyond academia. Every delayed trial means countless preventable infections and deaths across a continent that bears the world's heaviest HIV burden. Now, the collapse of US aid-funded clinics across Johannesburg and other urban centers has created treatment gaps that public hospitals simply cannot fill. Long queues form before dawn at remaining facilities where overworked staffs struggle to meet overwhelming demand. Healthcare workers reporting alarming increases in patients defaulting on treatment, some because they can't afford to miss work for all-day hospital visits, others due to medical shortages. These interruptions in care create perfect conditions for drug resistance to develop, potentially rendering entire classes of antiretrovirals if ineffective. South Africa's statistics paint a dire picture of what's at stake. The nation is home to 7.7 million people living with HIV, the highest number globally. And through PEPFAR, the landmark US initiative launched in 2003, about 5.9 million South Africans gained access to life-saving antiretroviral treatment. The program impact was transformative. It was a 66% reduction in AIDS-related deaths since 2010, and about 4 million African children spared or were spared from HIV infection since 2000. Now, public health experts warn that these hard-won gains may be erased. The public cuts have created particularly severe consequences for high-risk populations, sex workers, LGBTQ+ communities, and pregnant women, groups that have heavily relied on specialized, judgment-free clinics. They now face difficult choices between accessing care and protecting their privacy or livelihoods. Community health workers report disturbing increases in patients abandoning treatment rather than risk exposure at overwhelmed public facilities where confidentiality often gets compromised. Now, when you look now, you see that research into the next generation prevention tools has been hit especially hard. South Africa had been at the forefront of developing innovative solutions like the twice-yearly lenacapavir injection and various PrEP formulations. These breakthroughs, proven effective in South African trials, promise to revolutionize HIV prevention worldwide. Now their rollout hangs in limbo as funding dries up for follow-up studies and implementation programs. The economic implications are equally staggering. Health economists estimate that every dollar cut from HIV programs today will cost about $7 to $10 in future treatment expenses. South Africa's public health system, already strained by multiple burdens, may soon face waves of advanced HIV cases that require far more expensive intensive care. The potential human toll is incalculable. UNAIDS projects 6 million new global infections and 4 million AIDS-related deaths by 2029 if current trends continue. Now, while emergency funding from the Gates Foundation and Wellcome Trust has provided temporary relief, it covers barely 15% of the shortfall. Researchers describe working in survival mode, prioritizing only the most critical projects while entire lines of inquiry get abandoned. The long-term damage to Africa's scientific capacity may take generations to repair. With many promising young researchers already living for opportunities abroad. In government offices and university boardrooms across South Africa, health leaders are scrambling to develop contingency plans. Some even propose redirecting funds from other health priorities, while others advocate for urgent appeals to alternative international donors. All agree on one thing: the sobering reality, which is that without immediate intervention, the world risks witnessing the unthinkable, and that unthinkable is the resurgence of an epidemic that had finally been brought to heel. This is such a pitiful condition, and South Africa recorded about 7.7 million. 7.7 million infected cases of HIV, the highest recorded around the world. Is really something that calls for urgent intervention so that we won't end up witnessing the unthinkable. I am Great Dave, and do me a favor, smash the subscribe button for more African commentary on real life happenings, and hit the notification button, and man, don't forget, man, to tell a friend to tell a friend. See you next time. Hello my people, I am Great Dave. If you enjoy my vlogging and you wish to see more of this, do me a favor, hit the like button and also subscribe. If you're watching from Facebook, also give me a follow. I would really appreciate that. And yes, you can also share my works for your friends and family members. And also do not forget to hit the notification button just so you can get notified the very moment I drop. I hope to see you next time, and take care.